Good evening everyone. Hello bachcho. Am I audible and visible? Yes, Rohit Meena, Gamer 1260. Am I audible? So well. Okay. Today's topic is management of snake bite. That is venomous snake bite. As you know, there are 4 venomous snakes in India: common cobra, common crate, Russell's viper, and saw-scaled viper. Common cobra, that is naza, which is neurotoxic. Common crate, which is Bungarus ceruleus, which is also neurotoxic. Russell viper and saw-scaled viper, they are basically hemotoxic. Yes. Medlife, Sayantha, yes, okay, fine. Chalo. In the beginning, so in this session, we are going to discuss the clinical features in case of snake bite, the clinical signs, diagnosis, and the management, and few other clinical scenarios in the forensic medicine. In the beginning, here is the case of snake bite. You can see here there are 2 findings are there. In finding 1, there is a weakness of the levator palpebrae superioris, a case of neurotoxicity, and in one more image you can see the 2 dotted lines. Can anyone identify what are these 2 signs which are very common in venomous snake bite? Once again, what are these 2 signs? So let's make it interactive. So the finding here is basically ptosis. Okay. Ptosis. Ptosis is the earliest manifestation in case of neurotoxic snake bite, especially common cobra and common crate bite. It is because of weakness of extraocular muscle levator palpebrae superioris, that is LPS, supplied by oculomotor nerve. And in the second image, what we can see here, clearly visible fang mark. The fang mark is a feature of venomous snake bite. But try to understand, sometimes fang mark is invisible in case of common crate bite. Yes, common crate bite. Okay, chalo. Now one more image. Look at this, 2 videos are there. In first video, there is a patient with a snake around the neck. The snake has triangular head, constricted neck, broad body and pointed tail. So here is the patient bitten by venomous snake. Can identify this snake and the nature of venom that is produced by this particular snake. This snake, you can make out here triangular head, constricted neck, broad body, pointed tail. The bronze spots are there on the back, which is classical of viper. This is basically viper, Russell's viper. So the viper comes under Viperidae. The Viperidae are basically hemotoxic. Okay. Okay. So now one more slide. Can you just answer? There are 3 snakes are there in this. So very interesting. 3 snakes are there. And all the 3 are very poisonous. They are very venomous. In the left side, you can see the hood and the spectacle mark. That is very common snake in India. And in the middle, the constricted neck and triangular head. And in the third image, you can make out there is a snake which is common in near the sea. What are these snakes basically? Yes, Devasis is telling, sir, this is common cobra. Yes. So this is common cobra. It comes under Elapidae. Elapidae that produces bungarotoxin, basically alpha bungarotoxin and beta bungarotoxin, and this alpha and beta bungarotoxin that causes neurotoxicity, respiratory paralysis and death. And this is basically Viperidae. Viperidae, they are basically hemotoxic. And the third one, they are myotoxic. Example, sea snakes. Okay, so the snakes or venomous snakes are classified into Elapidae, Viperidae and Hydropidae. Hydropidae example is sea snake, Viperidae example is viper, and Elapidae example is common krait and common cobra. Okay, so with this introduction, so let's start the clinical scenario. So here is the clinical scenario. Scenario number 1. A 35-year-old farmer, agriculturist, presents to emergency department after being bitten on the hand. So very common while working in the field during daytime. He complains of severe pain at the site, swelling at the bite site. So try to understand, severe pain and swelling is a feature of venomous snake bite. Either it can be viper or it can be common cobra or common krait. Followed by drooping of eyelids, that is basically ptosis. The ptosis is the earliest manifestation in case of Elapidae because of bungarotoxin. Difficulty in speaking, he is having dysarthria, difficulty in swallowing, that is dysphagia. So what are the clinical signs here? Severe pain, swelling, followed by ptosis, followed by dysarthria and dysphagia. On further examination, the fang marks are present with a local edema and blistering. So blisters can be seen in various conditions. It can be a case of burn injury, carbon monoxide poison, it can be due to putrefaction, including snake bite. So blistering is there. So try to understand, this local edema blistering is absent in common krait bite. The common krait produces alpha bungarotoxin. This alpha bungarotoxin is basically presynaptic. That's why the common krait bite here, it is ruled out. It must be common cobra bite. Okay. Progressive neuroparalysis because of the involvement of the neuromuscular junction. Respiratory rate decreasing. That's why one very commonly done clinical test is single breath count test. Single breath count test. That is one very important clinical test we do or elicit in the patient. Respiratory rate decreasing. Which of the following is the most likely diagnosis? Can you answer now? Devasis, Chaudhary. What is this clinical scenario? Common krait bite, Indian cobra, Russell's viper, saw-scaled viper. I said already, it is not viper bite. The viper bite commonly presents with the hemotoxicity. Hemotoxicity. So there can be bleeding manifestations, increase clotting time, increase bleeding time, DIC, 20 minutes, whole blood clotting test. So it is not crate bite. Crate bite, the swelling is absent, local symptoms are totally minimal. The common crate bite resemble like stroke. Stroke in young patient. The history of sleeping on the floor go in favor of common crate bite. So the answer is, it is basically Indian cobra bite. Yes, Joshi is answering. Yes, very good Joshi. Answer is, it is common cobra bite. Okay, so this is one clinical scenario that is basically related to neurotoxicity. So after this, we are going to discuss two more clinical scenario, then diagnosis and the treatment. The second clinical scenario, a 42-year-old farmer brought to emergency department after snake bite on his leg while working in the field. He complains of severe pain, rapid progressive swelling. So try to understand, rapid progressive swelling is one of the very important indication for anti-snake venom injection. At the site bite, after few hours he develops bleeding from gums. So there is a bleeding, hematuria, the bleeding or RBCs in the urine, easy bruising over the skin, we call it as ecchymosis. On further examination, 20-minute whole blood clotting test, we call it as WCT, that shows incoagulable blood. That means, so there is a less clotting factors. So clotting factor are totally used, so there is a deficiency of clotting factors. So because of that, there is a bleeding, hematuria, easy bruising is there. So this go in favor of, what is the most likely diagnosis? Now same four options are there. Indian cobra bite, common crate bite, Russell viper bite, sea snake bite. Try all of you. Joshi and Venerixo and others, Debasis, beta can identify. So the clue in the patient here, severe pain is there, severe pain hai, rapidly progressive swelling hai, edema hai, bleeding gums, hematuria hai. So what is the most probable diagnosis? क्या हो सकता है? एक cobra bite or crate bite, Russell or sea snake? Sea snake commonly presents with the myotoxicity. Not the answer. Indian cobra, common crate, they presents with the ptosis or respiratory difficulty, broken neck sign, ptosis, dysphagia, dysarthria, all these are features. So what is the best answer? The answer is viper bite. So C is the correct answer. So this is the scenario number 2, clinical scenario 2. And the third scenario, look at this third scenario. Good answer. Mishra answered correctly. Mishra, very good Mishra. And midlife with Sahil, great. Many answered. Third scenario, a 30-year-old fisherman. So history here is fisherman. Presents after being bitten while working in sea water. He reports mild pain. So the pain here is very mild. Mild pain hai with the minimal swelling. Swelling is also minimal. After few hours, maybe 6 hours or 6 to 8 hours, he develops severe generalized muscle pain. We call it as myalgia, especially the muscle of the neck, the muscle of the shoulder girdle. So it commonly involves your shoulder girdle muscle. and the neck muscle. Okay, and progressive muscle weakness, passage of dark colored urine, that is because of the myoglobinuria. Now, what is the most likely diagnosis? No significant bleeding, no neuroparalysis, the muscles are tender, reduced muscle power. Options are same: Indian cobra, common crate, Russell viper, sea snake. So now it is your turn to answer. So what would be the best answer in this? Come on guys, come on, try. Now scenario 1 we discussed, scenario 2 that is viper, now scenario 3. Come on, try guys. So the finding here, the mild pain, minimal swelling, myalgia, no bleeding, no neuroparalysis, tender muscle, reduced muscle power. So that go in favor of Hydrophiinae. So what is the answer? Answer is Hydrophiinae. Hydrophiinae, they are basically sea snakes. Okay, sea snake. Very good. Now the funda here is, I am going to discuss again. When ptosis is there, when ptosis, respiratory difficulty is there, it is neurotoxicity. Bleeding and swelling is there, hemotoxicity. Weakness of the muscle, especially the muscle of the neck, then it is myotoxicity. Okay. Now local symptoms are, local necrosis is there, then it is common cobra. No necrosis, then it is common crate. So all these are important keywords. Okay? Yes, it is useful. If you want, you can just go through, no problem, Yeshwama. It is useful for all medicals, nursing, medical students, dental students, all students, and it is also a very important topic for general people as well, general knowledge. Chalo, ho gaya. So once again I'll repeat. Ptosis hai, so basically it is neurotoxic, either cobra or crate bite. Night bite hai, history of seizures, weakness in the morning, no swelling, then it is common crate. Bleeding is there, WCT count or WCT value is abnormal, then it is viper. Severe myalgia, cola colored urine, sea snake. Necrosis present, cobra. Severe pain at the site, severe pain, that means very severe pain, excruciating pain is a hallmark of viper bite. So this is how you can diagnose different venomous species by looking at the patient. And you can treat accordingly. I hope it is clear. Yeshwama, Vaniru, is it okay? चलो आगे देखते हैं. Now comes is the snake bite management. So how to manage snake bite? There is an approach. The approach is known as right approach. So all of you write in the chat box, right approach is equal to snake bite. So please write this. Right approach is equal to snake bite. What is the right approach? Let's discuss. All of you write right is equal to snake bite in the chat box. Try. R R for reassurance. One of the commonest cause of death in case of snake bite is fear. The fear induced cardiac arrest and death. So the first step is reassure the patient. Patient को समझाना and you need to calm the patient. Why? To prevent the sudden death. Reassurance, R for reassurance. I for immobilization. The immobilization basically to prevent the entry of snake venom into the vital organs, basically the heart and the brain and the other vital organs basically. So immobilization should be done, especially Sutherland wrapping. And the pressure should be less than diastolic blood pressure. It must be less than 50 to 60 millimeter of mercury. I for immobilization. Then G for GH. Get to the hospital immediately. GH means get to the hospital or government hospital, you can remember. So why? Because the most of the snake bite, the drug of choice, that is basically anti-snake venom. That is the only treatment available. So get to the hospital immediately. And T for tell the doctor about signs and symptoms. Signs and symptoms. Like example, the history of the about the snake bite, so type of snake, whatever, and about the signs and symptoms. So weakness, ptosis, dysphagia, dysarthria, abnormally sleepy, convulsions, paralysis, so drooping of eyelid, or bleeding manifestations, so myotoxicity, muscle weakness. So this is about the right approach. So this is very very important. Okay, चलो आगे देखते हैं. Now the treatment. So the treatment is basically ASV, anti-snake venom. So before that you need to maintain ABC, airway, breathing, circulation. So you can see here, so this is basically snake anti-venom or anti-serum, we call it as. Try to understand, depending upon the snake bite, in case of mild toxicity, around 10 vials. In a moderate, around 15 vials. And in severe, around 20 vials. Around 20 vials. So this is very very important. Just a minute. And the most common side effect. Can anyone tell me what is the most common side effect of ASV? Yes, come on guys. So ASV is basically lyophilized polyvalent enzyme refined equine immunoglobulin. So it is of horse origin. So what is the most common side effect? What you can see here, IV use, and this you can see here. After reconstitution, each ml neutralizes following quantities of standard venom. So 1 ml that can neutralize 0.6 milligram of Cobra. The common crate around 0.45 milligram, Russell Viper 0.6, saw-scaled Viper 0.45. Okay, so this is anti-snake venom. The most common side effect, can anyone try? What is the most common side effect? The most common side effect is anaphylaxis. So the treatment of anaphylaxis is adrenaline, that is 1 in 1000, or in severe cases you can use hydrocortisone. And one more point, if there is a serum sickness, then you can use prednisolone. So this is very important concept. Okay, chalo. Now look at this. So adrenaline and epinephrine both are same. Adrenaline, beta, epinephrine both are same. Adrenaline, noradrenaline. Epinephrine, norepinephrine. Both are secreted by your adrenal medulla. Chalo, theek hai. Now look at this. This is the case of poisonous snake bite. A 20-year-old female, she presented with common cobra bite with the difficulty in respiration. What you can see here, she was given with anti-snake venom and also the supportive measures like intubation. She recovered completely. So this is the importance of anti-snake venom and timely treatment in case of snake bite. I said in the beginning, common cobra presents with the weakness, ptosis, respiratory difficulty. The treatment is ASV. So after giving ASV, after 1 or 2 days, she recovered completely without any complications. Okay? So yes, so this is about the today's topic. Now let's discuss some forensic case MCQs. So pocket MCQ we call it as. Some interesting scenarios, the interesting real cases, real scenarios for next 5 to 10 minutes. Okay, forensic case MCQs, real cases. Now look at this. So this is one case, hypothetical case. It is hypothetical, everything is AI made, but the very famous case is bathtub murder case. It is something related to that. A 30-year-old woman found dead in bathtub filled with the water. The bathroom door was locked from the inside. On external examination, there are multiple abrasions over the neck, along with the ligature mark. On autopsy, no froth is present at the mouth and nostril. Lungs are not congested and there are no crepitations. No water is found in the stomach. So now this is one common case in forensic medicine. So what is the most likely manner of death? Accidental drowning, suicidal drowning, homicidal drowning, post-mortem immersion. Okay. Yes, come on, Joshia, can you try? What is this basically? So the patient came with a history of, so that is death, accidental death as per 194 BNSS. 194 is basically police inquest. It is a unnatural death. Inquiry is compulsory. So the inquiry is made as per 194 and the post-mortem was conducted. So during post-mortem examination, no froth, no congestion, no petechial hemorrhages, no cyanosis, and there is a clearly visible horizontal ligature mark. Ligature mark is there at the neck. What is the most probable diagnosis in this pocket forensic medicine case. Try guys, come on guys, try. So malnourished is telling, sir, ये C answer है, homicidal drowning. Okay, accidental drowning. Narayan is telling accidental. See, in any case of drowning, if it is drowning, accidental, suicidal, homicidal, one very common feature is froth and congestion, petechial hemorrhages and cyanosis. Datums are very common, especially in case of freshwater drowning or seawater drowning, but not in case of bathtub death. And here the one very important finding is the ligature mark. So ligature mark is there. So ligature mark, it is not seen in case of drowning. Ligature mark is classically seen in case of strangulation. So the cause of death in this case is strangulation. So strangulation and death, and later dead body was immersed in the water. That's why no signs and symptom. So the best answer is post-mortem immersion. Post-mortem immersion is the correct answer. So what is the diagnosis in this case? Diagnosis in this case, bathtub death with the ligature mark, with the minimal signs of drowning. I will go with post-mortem immersion. Clear-cut case of murder, clear-cut case of staging the murder or staging like an accidental death, that shows disappearance of evidence. That is also punishable offense under 229 and 234 IPC, BNS. So the answer is post-mortem immersion. Post means after. So dead body was immersed after death. So this is classical bathtub death. So all of you write in the chat box bathtub death in the chat box. Please write, everyone. Please write bathtub death. You can make it interactive, guys. You can make forensic interesting by doing interaction with me. You can keep yourself awake. You can keep myself awake. ठीक है? Got it. Vaniru. लिखो एक बार. आगे देखते हैं second question. Very interesting question, guys. Again, one more real case. Real case. Look at this. This is a classical idli vada case. Idli vada. A 35-year-old woman was brought to hospital in an unconscious state. She was unconscious. History of vomiting and giddiness. Vomiting hai, ulti hai, giddiness hai. After consuming idli given by her mother-in-law. Idli आपको पता होगा, idli in South India. So by her mother-in-law, she died within 1 hour of admission. The post-mortem examination, again it is a 194 case. That is police inquest case, police inquiry case, a case of unnatural death. So inquiry जरूरी है, investigation जरूरी है. So post-mortem बहुत important है. So इसमें क्या है finding? Finding है congestion है. इसमें है almond-like smell है. Stomach shows characteristic bitter almond smell. Chemical analysis shows something positive. We call it as Prussian blue. Prussian blue is positive. The Prussian blue test is positive. That gives rise to blue color. So options are organophosphorus, cyanide, arsenic and strychnine. Try now. Again, this is a very simple case now because the word given cyanide here already. It is not organophosphorus. In organophosphorus, it is insecticide. The patient commonly presents with slurge empty of salivation, lacrimation, urination, fasciculation, respiratory difficulty, and death. So there will be history of intake of insecticide, not the idli vada. So arsenic poison. Arsenic is an ideal homicidal agent. So the death occurs not within 1 hour, it takes many days. It presents with the rice watery stool, resemble like cholera, and it produces hemorrhagic gastroenteritis. We call it as red velvety stomach. Arsenic ruled out. Strychnine is a spinal poison, and in spinal poison the common features are the involvement of the muscles, all the muscles at a time. Lockjaw, opisthotonus, pleurosthotonus, embryostotonus, very, very common. So the best answer is, I'll go with cyanide poison. Okay. So B, very good, many answered. बहुत बढ़िया. So answer है cyanide poison. So cyanide, please write in the chat box. Guys, cyanide mallika. Cyanide mallika case. Real case. The same presentation. Almost same presentation. Write this. Cyanide mallika. Okay? Come on guys. Come on, try. This is very, very interesting case. You can just memorize. Congestion of organs, almond-like smell, Prussian blue, positive. The treatment of cyanide poison. याद रखना amyl nitrate, sodium nitrate, sodium thiosulfate. 3 drugs are used. And in cyanide poison, the postmortem examination, the color of the postmortem staining is brick red in color, cherry red carbon monoxide, pink in case of hypothermia. Frequently asked in the exam. Yes, good. Narayan is answering. That's great. I think, yes, good guys. Cyanide. Okay, second case is done and dusted. आगे देखते हैं Venom. हाँ, this is one more very, very interesting case, guys. On 7 September 1978, George Markov, a Bulgarian journalist, was standing at a bus stop. He was standing at a bus stop and Waterloo Bridge. He felt a sharp prick on his right thigh, just a prick, like a needle prick or some insect bite, as someone brushed past him with an umbrella. So with an umbrella. Within minutes, he developed pain, nausea, high fever, and he was admitted to the hospital. He died after 3 days. So in the dead body, what we found pellet. The poisonous pellet, okay, that is the point number 1, containing some toxic material. On further examination, brain hematoma or brain hemorrhage or kidney and all over hemorrhages all over the body, death occurred after 3 days. Now my question is, what is the diagnosis? Option A है arsenic poison. Arsenic poison ruled out because it resembles like cholera. Cyanide poison is ruled out. Bitter almond smell is not there. Death occur immediately, not 3 days. Organophosphorus, basically, that is an insecticide. The clinical presentation is totally different. So what is this case? Can anyone tell me? Venom beta. So the answer is, this is umbrella murder case. Good answer. All of you write in the chat box, umbrella murder case. Umbrella murder case. The poison used was ricin. The ricin is basically present in castor seeds. When this castor seed content, when it enters the skin, which is an organic irritant which causes anaphylaxis in all the sites. It also inhibits RNA polymerase, inhibits protein synthesis, it causes cell death. The fatal dosage around 9 to 10 seeds, or very small amount of ricin, which is an agent of bioterrorism, the class B agent of bioterrorism. The postmortem finding, they are totally non-specific. So the answer is ricin umbrella murder case. So this is what. Okay. Narayan and others, can you just type in the chat box umbrella murder case? Yes, come on guys. Type umbrella murder case in the chat box. Very beautiful picture that is showing umbrella. Umbrella is modified umbrella, like used as a weapon. The pellet was inserted in that. Just type umbrella case in the chat box for better understanding. So the clinical scenario one we discussed today, umbrella, Malika case and bathtub case. 3 cases. Okay, good नारायण, बहुत बढ़िया. आगे देखते हैं. Oh, next question, very interesting question guys. A 25-year-old woman from Kerala was found dead in her house. Again, this is a very important case. She was allegedly bitten by a snake while sleeping. So history of snake bite, not once, twice in her life. Not once, twice in her life. In the beginning, she was bitten by viper. In the second time, the same lady, she was bitten by the common cobra. Totally suspicious. There was a history of similar snake bite 1 month earlier. Investigation revealed that her husband has procured highly venomous snake used to kill her. The postmortem showed 2 distinct fang marks with a minimal surrounding reaction. There were no signs of struggle. Which of the following most strongly supports homicidal snake envenomation in this case? Options are bite occurring during sleep at night, previous history of snake bite in the same victim, minimal local reaction, unusual circumstances, deliberate procurement of the snake. So one more very common type of snake bite, the clinical feature. This is a case of common cobra bite. Okay, common cobra bite. Chalo, theek hai. Narayan and others, can you try this? Okay, so this is actually a case of cobra bite and this is a case of murder. So the answer is unusual circumstances with a deliberate procurement of the snake. That is very important, circumstantial evidence in this case. Good. Okay, so D is the best answer. Can make out here. You can make out the 4 important findings here. Fang mark is there. Oblique ligature mark is a feature of strangulation, you don't worry. Fracture of head bone is common in case of hanging or in case of strangulation. And recovery of Russell viper and the common cobra. So the answer is basically D is the answer. Yes. And the last question. And the last question of the day. So all of you try this. This question is very nice question. Yes. 35-year-old man was found dead on his bed in a rented room. There were no major external injury. On autopsy, there was facial congestion, cyanosis, petechial hemorrhages. There were mild abrasions around the nose and mouth. Investigation revealed that the accused had pressed a pillow over the face of the victim, was sitting on the chest of the victim. So what is this method known as? In this method, the findings are petechial hemorrhages, facial congestion and cyanosis, abrasion around the nose and mouth. Options are throttling, traumatic asphyxia, smothering and burking. So this is a combination of two. One is smothering, one is traumatic asphyxia. So the best answer is, can anyone try? Can anyone try this question, guys? Smothering plus traumatic asphyxia. So go in favor of burking. So burking is a method of suffocation. Suffocation, yes, Dr. Gaurav, good answer. So this is about the 5 important scenario. So let's discuss one by one. The first one, it was the bathtub death. Second one, Idli-Vada case, cyanide case. Third case, umbrella case, Ricin case. And the fourth case, basically that is Cobra case. And the last case, smothering and traumatic asphyxia, that is basically burking. So this completes your today's session. Thank you all. So if you want a PDF of the class or more upcoming presentation, you just mention FMT of Pocket Clinics in the chat box or in the comment section. So stay connected. Thank you all. So Veniru, Narayan. Any doubt? If you have any doubt, you can ask me. This is the first class of the Pocket Clinics, especially FMT Pocket Clinic. In this session, we discussed in detail about the snake bite management. As I said, there are big four snakes in India. So common crate, common cobra, Russell viper and saw-scaled viper. Treatment of choice is ASV. So ASV along with the normal saline infusion, there is a drug of choice. The most common side effect is anaphylaxis. Okay, so any doubt, you can ask me for next 5 minutes, last 5 minutes. Not every day, it's no nephrology in this. The only forensic medicine and toxicology. So basically related to BNS, BNSS and BSA, all legal sections. So the application of medical knowledge in legal field as well as legal knowledge in the medical field, that we call it as forensic medicine. So if you have any doubt, if you want any other class, you let me know, especially related to forensic medicine. Yes, this Pocket Clinics runs every day. So I think every day one clinical case. Okay, Narayan is telling, if a small child is bitten by venomous snake, okay, so this is the good question asked by Narayan. So Narayan, ASV, same dose in children. Same dose in children. The adult is equal to child in relation with the ASV dose. Okay. Any other doubt? Thank you, Aniru. Yeah, Narayan, good question. Neostigmin given only in the cobra bite, not in the case of common crate, because common crate is presynaptic and common cobra is postsynaptic. Neostigmin very useful in common cobra bite. So it increases so levels of acetylcholine, there will be some improvement. So that is clinically proven as well. Yes. So this completes the today's session. So thank you all. So let's come up with some more important clinical cases, the important forensic medicine cases